In relation to our own project, I'm going to talk to you about Learning for Lives Ghana, which is translatable to other countries as well, so we've kept the title generic. So it has been a great honour to work on this in the last couple of years. It's between the UL Hospital Group and the University of Limerick. So there's three key people, just to acknowledge them today: Paul Finucane, who was the Chief Academic Officer, and Katie Sheehan, the Assistant Director of Nursing in Croom, and Kelly Hadfield, who helped us with the in-Ghana logistics, and we couldn't have done it without those people. And it was part of our strategic plan in 2014, and it continues to be part of our strategic plan in the hospital group for 2018 to 22. So how it was organised, it's basically a group of people who are interested in connecting with the developing countries, what we had looked at the time, but it proved quite difficult to do that a few years back. And so a collaborative steering group was set up once Kelly and Katie and Paul had I suppose, the magic that we thought we could do something. And out of that then, so involved with a hospital group in terms of we've provided a lot of the leadership and the clinical expertise with nursing and doctors going out to Ghana, and then the UL Paramedic School in relation to the research, and everyone that goes out is part of the team that actually train. So what we do is, and the Ghana, in Ghana logistics as well, help out with all of the dynamics of getting to Ghana, etc. So, and as with everyone today, funding has come from everything from self to donations to organisational support. And basically what we do is there's 220 CHIPS areas in the Upper West region of Wa, and they are involved in basically community care. It's like one-roomed healthcare facilities in the community. And what happened was basically, I suppose, they're not getting a lot of training or support, and a lot of patients or people are dying unnecessarily. So from there, doing the needs analysis in 2016, it was first decided that they asked us to come back and do pre-hospital emergency care. So that was the first program that we started with. And then from there, we've since developed other like physio programs and sepsis training and hand hygiene and things like that. So basically, just to make the whole theme today is about partnerships. So this year I had the privilege to go into Cape Coast University in Ghana to see could we extend our partnerships around this. And basically we met with the Educational Research Centre, the Cape Coast Teaching Hospital, the University of Cape Coast, and very important, the Padre Pio Centre as well in Ghana, who has done amazing work with marginalised people and children who are literally, if they have any disabilities, they're left out of their community or their family. And he's done amazing work there. So it's turned into more collaborations than we anticipated. So basically this year, the main thing that we've achieved in terms of, because of the time constraint, is we've done actually this year train the trainer program. So we've gone out and trained 80 CHIPS regions, so in the community, gone back last year and did, this year and did 80 more. And on top of that, we did train the trainer for sustainability. So they can actually train now, and physiotherapy program, sepsis training, hand hygiene, and we did some neonatal scope out as well, and provided the medical kits to go with that training for the pre-hospital emergency care. So all of this was underpinned by research, and we continually monitor and improve. So that's the fantastic piece about working with the University of Limerick as well, is that they provide all the research in terms of what the volunteers get out of it, and what in terms of the learning for the students as well. That's been very valuable. So I'm going to show you a little quick synopsis of a video.
Upon you, fire upon you. Don't have it, please don't hate me. You can make it if you are sitting down. When I'm working, you're slipping, and I get paid. You hate it, super only, yeah.
If you want something you never had, then you got to do something you never done. Respect to the hardworking youth.
Fire burn you, upon you, fire burn you.
Show and show.
Fire burn you,
Can show what time is coming.
fire burn you,
Can show.
upon you,
Can show.
fire burn you,
Can show.
fire burn you, upon you, fire burn you.
So we're hoping to do a memorandum of understanding with the Padre Pio Centre that is very close to many of our hearts now, and the MOU with the Cape Coast University and the UL Hospital Groups, and also the university as well. So there's a lot of good things we hope to come. Thank you very much.